Go ahead, Donna.
Great. Good afternoon, everyone. And I'm Donna Lynne. I am the University COVID Director and also have several roles here at CYMC. I want to welcome everyone to another forum, this one, Return to Campus, focused on the classrooms. We have our regular panelists, Dr. Wafaa El-Sadr, Dr. Melanie Bernitz, David Greenberg, Gerry Rosberg, and we also have two special panelists, Julie Kornfeld and Lisa Rosen-Metsch, and they are going to really focus on the return to the classroom and what it looks like. I hope if you're on campus, you can feel the excitement with students returning. We've had students returning in waves during August for some of the graduate schools, but also many of the undergraduates have arrived. We celebrated convocation, and students are moving into their dorm rooms, and we're gearing up for the undergraduates and for some of the graduate schools for September 9th, which will be our first day of classes for many, many students. So welcome to the students. They're all excited, and we hope the faculty and staff who are going to be teaching and continuing their work in research and in clinical care are also similarly excited to see something that we haven't seen since 2019. So really excited to have everybody back on the campus. There certainly are some challenges. We're going to talk about the various safety measures that we have put in place to make sure that everyone is kept safe on the campus. We've been doing this webinar every other Tuesday. We made the last couple just weekly because there was so much going on. Next week in observance of the Jewish holidays, we will not have a webinar, but we will be back on September 14th with more updates. Excuse me. Last thing I just want to mention before we launch into a very brief quiz that we'd like to get your feedback on is one thing I've mentioned on the vaccine front that has developed recently is a declaration that booster shots, meaning a third shot for those who got Pfizer and Moderna, will become available. They actually are available now for certain categories of immunocompromised individuals. We are providing them at Columbia doctors in various locations, but they're also widely available in your drugstores and in other locations around the city. So if you fit into those categories, we encourage you to use some of your community resources, or you can come into Columbia. We expect, although we have not heard how the expansion will roll out, but we expect September 20th, the president promised that there would be a further rollout of eligibility for the booster shots for people who got their vaccines 8 months or more ago. And we certainly are in that window because we started doing vaccinations for healthcare workers in December of 2020. So we will be providing those at no cost to our Columbia faculty, staff, and students where they qualify, and we'll be announcing the sequence in which we will be doing that once we get the guidance from the CDC and also the guidance from New York State. So lots to happen over the next couple of weeks. You'll hear from several of our panelists about other compliance requirements. Right now, the booster is not a requirement, but certainly the other vaccinations, either the 2 doses of the two vaccines I mentioned or the J&J vaccine, are going to be a requirement for everyone who works for Columbia and for every student at Columbia, and we'll talk about the logistics around that. But Robert, why don't we go to our brief quiz that will help inform us about how to be more responsive to some of the concerns that each of you have. And as you can see, there are 4 simple questions. And if you would indicate your responses, we will get the answers up for you. Okay, so the first question, have you been to your workplace since May 1st of this year? And we've got a strong percentage of people, 80% have. And then we wanted to get a sense of how frequently you have been to your workplace, a pretty even distribution. We do have a cluster of people who said they've been here more than 10 times. Thank you for giving us that sense. And then 99% recognition of the four, I always call them the four keys to getting access to the campus: vaccine compliance, compact signing, training, and gateway testing. So that's great. And then we have 92% of the population listening who have completed all of the steps to get a green pass. So thank you so much for that feedback. Before we start, we're going to start with Wafaa. I just want to let you know that you will be unable, this is a different kind of a webinar, to drop questions into a Q&A box. We asked as you registered to submit questions. So at the conclusion of everyone's remarks, we'll go through the questions that were submitted to us ahead of time. Honestly, I think the people answering the questions found that sometimes there were 10 of the same question, or there were questions that we were already covering in our remarks. So this is a much more efficient way for us to get to your questions. So a reminder, if you didn't notice that when you registered, certainly for the September 14th webinar, we'll be using the same format. So let me turn it over to Wafaa, because we have some good news in terms of how COVID is impacting New York City.
Great, thank you very much, and Donna and everyone for joining us today, and hopefully you can see this, right? Does it look okay?
Yep.
Okay, thank you. So let me just take a minute to, yes. So what I'm going to do today is just provide a very brief update on COVID-19 and where we're at. So I've entitled the slide, COVID-19 Vaccination, a Game Changer. And I hope to convince you in this brief presentation that having the availability of the very efficacious and effective vaccines we have at hand is that indeed vaccinations are a game changer. And you can see here this global map again shows the levels of coverage of vaccinations, doses per 100 person, 100 population. And in the darkest green are the highest rates of vaccination. You can see that the US and certainly several other countries around the world have done quite well in terms of achieving high vaccination rates overall compared to some other parts of the world. And then again, in the US, if we look at the same thing in terms of the percent of residents who are 12 years or older who are fully vaccinated, this is fully vaccinated. And you can see here that we have a variability across the country. But fortunately, in the area where we are situated, New York City, right here, is that we are fortunate to have some of the highest rates of vaccinations in the country. And this, of course, is reflected because, as you can see from here, COVID-19 situation in the United States now, and you can see in this map here on the lower right, left-hand corner, is that we have that this is actually showing the average daily cases of COVID-19 per 100,000 population in the past week. So these are recent cases. And the darker the red, the higher the number of recent cases. And you can see again that in areas of the country like ours, where there's high vaccination rates, we are seeing the lower average numbers of cases recently. So that tells us that there's certainly an association with the vaccination. Of course, these are probably some of the parts of the country that are also more likely to be observing some of the other protective measures like masking and so on and so forth. But nonetheless, this is important data in terms of the vaccination and their effectiveness. Now, what's been happening in New York City? And I'd like to start by showing this slide. And this shows the epidemiology. This is the numbers of cases here in thousands, up to 8,000, and this is about 6,000. And I want you to contrast what we're experiencing now, which is in this last surge of this pandemic, versus what we experienced in what I call the winter surge in January and February of this year, where we had a much higher surge in numbers of cases. And I think it's important to keep that in mind because it's actually now we are experiencing the Delta variant. So what that shows is that even in the presence of the Delta variant, having a substantial proportion of the population vaccinated certainly has mitigated the surge that we have experienced recently. So that's important to also keep in mind when you contrast those two surges here. And then more recently, I think we have good news, and this is looking now, this is numbers of cases, this is daily numbers of cases in New York City, and you can see that we were increasing in the surge, but now we have plateaued, and there's a beginning of a decrease in the numbers of daily new cases reported in New York City. So this is also really good news as we move forward in the fall. Now, in terms of hospitalizations, I want to show you again the difference in hospitalizations in New York City between the winter surge versus the surge we're experiencing now. And you'll notice that, again, that we're experiencing fewer hospitalizations, daily hospitalizations than certainly we did during the winter surge. And that, again, is important to keep in mind. And this is, again, in the context of the Delta, the prevailing prevalence, the prevailing variant, the Delta variant in our community. So this again links back to the good news in terms of the effectiveness of our vaccines, particularly in prevention of severe cases and hospitalizations. And then when you look at recently hospitalization rates, there's similarly good news. While we had this is again, keep in mind here that the y-axis is very different. This is about 100 new cases per day, hospitalization or so here, up to here. And you can see that while we experience an increase in numbers of hospitalizations, we have plateaued and now are beginning to experience as well a decrease in hospitalizations during this period of time. So that is also good news to keep in mind. And I just want to show you another metric that the CDC and New York City is using, and this is the transmission rates in New York City. And this is simply calculated by taking the total new numbers of cases per 100,000 population New York City in the last 7 days. And you can see, again, this is citywide, that we did have that increase in numbers of cases as part of this surge, but we have plateaued and are decreasing in terms of transmission rates in New York City. And this is even being experienced in Staten Island, that has always had the highest surge in terms of numbers of cases. So all of this is coming together around the story is that we appear to be plateauing, if not decreasing, in terms of numbers of cases and hospitalizations and transmission. And most importantly, it highlights, of course, the value of the vaccination, even in the context of Delta variant prevalence. So let me also briefly show you some other data, and this is looking at cases and hospitalizations by vaccination status. And I'll start, these are data first from New York State Department of Health, and they looked at the period during during the Delta appearance in the city here from May till the end of July, and they showed that in terms of new COVID cases, there was appeared to be a decrease in declining vaccine effectiveness from 91% to about 80% or so. However, you can see most importantly is in terms of vaccination, in terms of hospitalizations, that over the same period of time, it stayed the same, if not actually a better effectiveness, although slightly better in terms of prevention of hospitalizations, 95.3% effectiveness in the COVID era, in the Delta era. And these are similar data that I wanted to share with you from Los Angeles County, a place that's quite similar to New York City in terms of vaccination uptake. And here, the data from Los Angeles County we looked at in a very similar period of time from May till the end of July by vaccination status. And essentially what you can see in this curve here is that when you look at the period of time, this period of time, this here is the number of cases per 100,000 population amongst the individuals who are unvaccinated compared to those who are vaccinated or partially vaccinated. And similarly, if you look at hospitalizations, you see an even more dramatic difference where you can see the rates per 100,000 of COVID-19 hospitalizations among those who are unvaccinated versus those who are vaccinated. So all of these are essentially showing us that there are reassuring data that, that the effectiveness of our vaccines is durable during the Delta era. And to end now with some New York City data, and these are looking at the hospitalization rate per 100,000 population in New York City. And you can see the rates are much higher amongst unvaccinated than it is amongst vaccinated, fully vaccinated individuals. And again, if you look at cases, outcome, these are cases, not hospitalization, you will see again that the rates of COVID-19 are about 3 times higher amongst those who are unvaccinated compared to those who are fully vaccinated. So it's demonstrating what we have known is that these vaccines are quite efficacious and effective, particularly in preventing severe illness and hospitalization. So just to show you that I think what we have in mind now is we have these multiple layers of protections, and my colleagues will talk about that, and including, of course, very importantly, this is a figure that's called the Swiss cheese figure, and you can see all these protective measures, and with vaccination as important as one of very important group of measures we have in place. So as we, just to leave you with this idea of a new narrative when we talk about this pandemic is now we are adjusting and reaching a level what we are hoping to be in a situation where we are an endemic situation versus the epidemic situation. And it's likely that this is what we're experiencing and will continue to experience in settings where there's high rates of vaccination, especially with high efficacy, where there will be continued numbers of cases of COVID-19, albeit again with mildly symptomatic cases or asymptomatic cases, while there'll be limited, more limited transmission and certainly more limited morbidity in terms of hospitalizations and deaths. And that's it, and I'll stop here and stop sharing my screen. Thank you very much.
Thank you, Wafaa. We're going to turn to Julie to set a framework for what the return to classroom looks like.
Unmute. Okay, sorry. Thank you. Thank you, Wafaa. Just kind of sorry about that. Okay. Okay, so thank you. And what I'm going to do as Wafaa described the multiple layers, we're going to talk a little bit more about the different safety measures we've put in place and the protocols we have. For those of you who joined us last week, you'll hear some of the same things, but we've really tried to update the presentations in response to the many questions that we've been hearing throughout the week. As some of our colleagues have returned to the classroom and things have come up for them, and we've been trying to stay a couple steps ahead, although we're running as fast as we can. But I will say I walked to my office today across a very happy campus of many, many students and their families. So very exciting to see where we are. So again, I think I think Wafaa's graph showed this much more interestingly, but I think if you look at the multiple layers that we have in place to ensure a safe return to campus, we have the vaccination mandate, we have a rigorous testing program that goes from gateway to surveillance to wastewater testing and other supplemental and voluntary testing. We have a seasoned contact tracing team, a face covering policy, an updated Columbia Compact, safety training that's required for all on campus. We have a daily symptom attestation, restrictions on gatherings and visitors, environmental upgrades to all of our facilities. And as you come back to campus, many, many signs to remind you of all the different layers that we have in place. So I think this gives you a holistic view of the many things that we have in place. I'll talk a little bit more about each of them and then turn to Melanie to talk specifically about contact tracing. Again, as we talked about last week, we have a mandatory vaccination mandate in place. It applies to everybody, whether you're a faculty, a student, a researcher, and on whether you are a student on campus or off. So even those that are enrolled in our online programs are required to vaccinate. Those who have not submitted vaccination documentation or received an approved medical or religious exemption will not be able to access campus facilities, including dorms, and they won't be able to participate in academic research or extracurricular activities. International students, as many of you know, are coming here unable to receive vaccines. They're coming here unvaccinated because they weren't able to receive vaccines in their own country, and we're getting them in and vaccinated right as they arrive, and they have temporary authorization to access campus. They'll have health and safety protocols that they have to follow, including regular testing and required face coverings, and then they will be mandated to comply with the vaccine mandate as well. We're also working really closely both on this campus with Columbia Health and Student Health on Haven at CUIMC to make sure that every school achieves 100% student compliance between now and the first day of class. We are working very closely together. We've been updating the data every day. Schools are giving us updated rosters, and CU Health is matching that to enrolled students to vaccine documentation. And this includes, again, all students across programs. We're using a multi-pronged communication approach. So CU Health is sending constant reminders to those or letting them know the pieces of documentation that they might be missing. And schools are communicating individually to every student, letting them know that if they don't come into compliance, they will be de-enrolled or deregistered and unable to return to their program if they're not in compliance with the vaccine mandate. So let's talk a little bit about face coverings. So we mentioned this last week, everybody must wear face coverings in indoor campus spaces, including classrooms. We've had a lot of questions about the types of masks. Here you can see the ones that are approved on. You do not have to wear an N95 or KN95 mask. You can have a 2-ply fabric mask or a surgical mask when you're on campus. If you're unvaccinated, you have to wear both face coverings, both indoors and outdoors. We've talked about this again. Faculty and instructional staff can teach without or with a face covering if they have the ability to maintain 6 feet of distance from students. And they must put their face covering on immediately after completing their instruction. We've had questions around this about people who are standing in front of a classroom conducting, if it's a staff member who's talking during orientation or even later in the semester as students come to present in class. Again, if they're presenting and they're able to maintain the 6 feet of distance at the front of the classroom, they can remove their mask, but need to put it back on as soon as they return to their seats and finish with their instruction. Failure to comply, we've had people ask about this too. And so if you have someone in your classroom who is not wearing a face covering, in other words, they're not complying with the Columbia Compact, they will and should be asked to leave the classroom and campus. And you'll see that we'll have Columbia branded face coverings available at orientation and throughout the campus. Okay, so positive cases in the classroom. I'm going to talk a little bit about this, and Melanie's going to jump in and talk very specifically about what happens in terms of contact tracing. So we talked about this last week. Any member of the Columbia community who has a positive COVID test will need to isolate for 10 days from the time of their first symptom or the time of their positive test. So, what does this mean for attendance and missed classes? Students who are adhering to this university required isolation cannot attend class, must not attend class. Their absences relating to their COVID diagnosis will be recognized as excused absences, and students will not be penalized. Students need to be in communication with their faculty member because they need to be able to make up any missed classes, assignments, coursework, etc. They are not required to disclose the reason for their absence to the instructor, but so they can just let them know it's for a medical reason. I think I have a typo there. Sorry about that. So students should contact their instructor. They should let them know what are their required dates of isolation, so they have communication, and instructors are expected to make reasonable accommodations for students. We've had a lot of questions about what are reasonable accommodations for students. So let me say a few things here. If you're recording your class, some faculty members are recording their class. Certainly if a student is ill and they can't attend class and you want to make that recording available to the student, you can. It's not required that you record the class, and we're leaving what the reasonable accommodation is up to faculty because it will vary by class. If there are several students absent, a faculty member or a TA may want to hold a makeup class. Faculty members may want to share their slide presentations or course materials and feel that that's sufficient to allow the student to make up the class. But students will not be penalized, and they will be able to progress while they're in isolation. So this is, again, if there's a possible exposure to COVID-19 in the classroom. So just to talk a little bit about this, because we've had many questions. Vaccinated students, and this again, I think if we think about Wafaa's allusion to sort of the game-changing environment that we're in, we are now a fully vaccinated campus and we're masked. So vaccinated students who are not symptomatic but have been in close contact with an individual who tests positive do not need to quarantine or isolate. They can continue to attend class. They should get tested on days between days 3 and 5. Unvaccinated students with a close contact must quarantine, and the duration of their quarantine depends on testing it depends on their testing. These students should also inform their instructor of the duration of their absence, and they may disclose the reason of their absence, but are not required to do so. Students who have close contact and are experiencing symptoms should not attend class and should get a COVID test. So I think this is fairly straightforward. If you're vaccinated and you've been in close contact and you're asymptomatic, you're not experiencing any symptoms, you're asymptomatic, you can continue to stay in class. If you have or you are experiencing symptoms, you should not go to class and get tested, and should, depending on how you feel, this student can continue to participate not in in-person classes, but can keep up with readings, can view things online, et cetera, if they're available. So some faculty guidance, because we've had many questions on this. So I think, and again, Melanie's going to talk very specifically about what happens when there's a positive case in the classroom. But we wanted to really reassure faculty and instructors it is not your role to inform the class or otherwise to manage communications about positive cases or close contacts. Columbia Health will do that. And again, Melanie will speak a little bit more about that. So faculty can and should feel ensured that Columbia contact tracing program will promptly be mobilized once a case is identified. We should be reminding students of all the safety measures in place and trying to reassure students that there are many safety measures in place. And students should be referred if they have health-related questions or concerns to student health or to the website. Again, I think we want to make sure the faculty understand we're not expecting them to be public health experts. We're not asking them to manage questions about students' health, and they shouldn't be communicating what the protocols are for public health, as those things will take place from Columbia Health centrally. Okay, a couple more points before I turn this over. We, as mentioned, we're restricting external visitors, right, to campus. All non-CU visitors to residential buildings are restricted. We're keeping in-person events very limited for the fall. We're giving priority to activities that support our academic mission and student life. And vaccinations will be required for all visitors. And frankly, for most events that are getting exceptions to be held, we're requiring that most of the schools are making sure that anybody's attending, whether it's a guest speaker, will be vaccinated and in compliant with the Columbia Compact. I want to just mention that some courses have guest lectures, and it's really critical that those guest lectures come in person for the semester. We're trying to limit that only to circumstances where that is critical to the academic mission, to the course, to the success of the class. Those things are not approved by the provost office. They're approved at the dean level and at the school level, and the schools can approve those. The dean needs to approve them and also monitor whether or not the guest speaker, ensuring that the guest speaker is vaccinated and is complying with the Columbia Compact. Mentioned this last week, this has not changed. Students are required, if they're in academic experience off campus, to still adhere to the Columbia Compact. And if their host organization has additional requirements, they need to comply with those as well. And again, international placement is subject to our travel restrictions. So I'll end with a couple of takeaways. I think, again, we have many robust safety measures in place. We've had experience. We've had more than 10,000 Columbia faculty, researchers, students, and staff regularly on campus. We have evidence, and so I think this is also important, and that we talked about this previously, we all share responsibility in ensuring that we have a safe campus environment. I think it's really important to remind everybody that what happens off campus matters. The evidence is that the majority of our transmission is not occurring inside our classrooms where we are masked and are fully vaccinated, but occurs outside the classroom in off-campus gatherings and in social context. So what happens off campus matters, and we want to be careful. And I think lastly, as you know, Wafaa indicated, the situation is continually changing. Our decision-making will continue to be informed by the science. We will adjust and adhere to our COVID-19 monitoring plan. And you can watch and look at the metrics of that plan on our website. And we will be continually monitoring the situation and adhering to that plan. So I'm going to stop there.
Thank you, Julie. We're going to turn to Melanie to go a little deeper on our various requirements as you come back to campus, and then we'll hear from Lisa about her experience being on campus.
Great, thank you, Donna. Thank you, Julie, and good afternoon, everyone. I share the excitement outside my window right now. The students are back, and it's really wonderful to see. Just to remind you all that the data from all of our measures we post every week on the covid19.columbia.edu website. Here is the data from last week's testing. You can see that the number of tests being conducted have gone up, and actually about 60% of those tests last week were gateway tests. And as Wafaa explained, we expect to see more positive cases by doing this testing, but the percentage positivity rate is remaining very low. As you can see from all of our cumulative testing, we were at 0.46% last week, and through our random surveillance program last week at 0.4%. So one of the many layers of Swiss cheese that Wafaa described is the testing program, and we'll continue to publish that data each week. So I did want to share a little bit more detail about the contact tracing and how it really impacts the classroom and faculty. And just as a reminder, we did establish our own contact tracing team last summer. So we've really got a well-established, robust, well-oiled machine that is working. And we engage anytime there is a positive test. We'll talk through the different ways that they feed into the system. But the goal of the contact tracing team is really, as others have explained, to quickly identify and contain and suppress transmission. And this is very much based on the initial interview with the case, so that we can identify who they have been in close contact with as defined by the CDC during the time they were infectious. And this is one of the reasons why we don't ask anyone else to try and do this work. It's very complex around test positivity, symptoms, vaccination status, and when someone is infectious. And that really impacts who is defined as a close contact. And then the team will be able to then reach out to close contacts and provide guidance. It is strictly a confidential process. We do keep the confidentiality of cases and close contacts private unless they ask us otherwise. Cooperating with contact tracing is a required part of the compact. So for our students, our faculty and staff, we ask everyone to cooperate. And if someone is non-cooperative, it is considered a breach of the compact, and we will take appropriate measures, again, just to ensure we continue to keep the campus safe. I've highlighted here this really important piece. There is a process, and I'm going to talk through it. But if the contact tracing team does not notify you, and you've not otherwise been notified by a public health authority, you've not been deemed a close contact, and you don't need to take any further action. I know that sometimes adds to the anxiety because people want to know all the information all the time, but please be assured that the system does work to notify those who need notification, and within the time frame, within the 72-hour time frame, not hearing anything means you have not been identified as a close contact. So what actually happens? I shared some of this slide last week for those of you who were here. There are different ways that a positive case feeds into our system. Again, through our surveillance testing program, we know about all those positive cases, and that immediately will trigger contact tracing. Similarly, we ask anyone who tests positive outside of our program, and that can be people who have symptoms and are going to an urgent care, are doing a rapid home test, should notify us through COVID test trace at columbia.edu. That triggers contact tracing. And for our students on both campuses who may be symptomatic and come in for evaluation in our on-campus health centers and have a rapid test done, that then feeds into contact tracing as well. So I've mentioned some of the important elements of the communication chain, confidentiality being key. Also, limiting the notifications to those who really need to know. We don't want to share protected information more widely. We've done plenty of planning in advance, so there are templated messages ready to go depending on the situation, and also thinking through operational needs, facilities needs. And the notification is done in coordination with the contact tracing team. This is really important. Again, we want to make it easy for our departments, our faculty, and our staff, not expecting people to have to do notifications and being unable to answer questions. So allowing this process to happen through contact tracing is really critical. Julie shared most of this, but just to highlight here, what happens if someone tests positive, student, faculty, or staff? Again, the contact tracing team responds and assesses the situation. The individual who tests positive isolates for a minimum of 10 days. Again, that count is dependent on their symptoms and their testing date. So our contact tracing team works and gets that information to the case. But the yellow section here, and Julie mentioned this, close contacts who are fully vaccinated and have no symptoms, so someone sitting next to the case in the classroom or at the orientation event with them, do not need to quarantine. That individual does need to mask both indoor and outdoors and get tested 3 to 5 days after exposure. And after they have a negative test, they then only need to follow our indoor mask guidance. But that is the majority of our campus. They're fully vaccinated. So if they have a close contact, they will not need to quarantine. They will not need to be excused from class. Anyone who has received a vaccine exemption, or for our international students who are not yet fully vaccinated and do have a close contact exposure, will need to quarantine for 10 days. They similarly get tested 3 to 5 days after exposure, but the quarantine is a full 10 days. And if there is any question, we always are on the side of caution, and we will follow guidance based on vaccination status. This, I pulled this visual. This is actually on the COVID-19 website. If you test positive, it's a PDF under our documents library, but it kind of shows the cascade of events that happen after an individual tests positive. So the first, if anyone tests positive through our program, they get a call as soon as we get the positive result from one of our clinicians. And that healthcare provider will provide guidance about the next steps for isolation and ongoing care. If faculty and staff do test positive, they are also told to contact their primary care provider for additional follow-up. But we will give that initial isolation instruction. At that stage, you'll update your attestation on the app and you will begin isolating. If you're out at the time you get the call, we ask that you go home and isolate. For our students on campus, when we talk about isolation, it really depends where they live. For our undergraduates, we do move into an isolation dorm. For our graduate students, most are able to isolate in place, but if they are in a Columbia residential building and there is questions about the ability to isolate in place, we do work with Columbia Residential and move them as needed. We have guidance, extensive guidance on the COVID-19 website for both students and faculty and staff in terms of how to isolate safely. So really good resources there. So that's the first thing that happens on the day we get the positive test result. Then we have this another cascade of information. Again, this is all available on the website, and the contact tracing interview takes place. It's usually within 1 day of the positive case. Often it's within a few hours, obviously depending on volume, but we do contact trace 7 days a week. So even when we get weekend responses, we do contact trace over the weekend. And during that extensive interview, which can last 45 minutes or more, the individual case is asked about Columbia spaces and facilities they've been in, the potential close contacts as defined here. We then notify close contacts and provide guidance. And this has really evolved, as we've been explaining, because of vaccination. And the quarantine guidance is very different now, as we've shared. We do keep this confidential. We do also remind any cases and contacts that they may also be traced by the local health authority, depending on where they live. And then we provide ongoing support during that isolation period for our students. They get a call every day from one of our medical case managers to provide us appropriate support. For staff, the contact tracing team continues to follow up until discharge from isolation. So it really does flow through, and that's how the students will then be able to communicate what their needs are during their isolation or quarantine period. So again, just to share with you all finally what happens after we get a positive case. Again, the contact tracing is initiated, that flow of events happens, but then there's a bunch of communication notifications that I alluded to earlier. Again, without identifying the case, we send a bunch of different notifications. A notification goes out to the school or the department if there's been a case, letting them know there's been an individual who's tested positive, that contact tracing has occurred, that the close contacts are being notified, and where we are in the process. We also do that, and again, a lot of these are happening at the same time. Close contacts are getting individual notifications. Those who need to quarantine are being notified individually. Similarly, classroom notifications go out if there has been a positive case who was on campus and in a classroom. And that goes out to all students, faculty, and TAs who were in that classroom, again, with very explicit instructions. So you may get that classroom notification and have heard nothing else, and that means you were not identified as a close contact needing to take any further action. But it does give instructions with the ability to reach out to the contact tracing team should you have any questions. And finally, facilities notifications are shared. If there's any need for cleaning, depending on where the case was, those notifications go out as well. So again, a whole cascade that happens, a lot of it simultaneously. And in this process, we let the people know who need to know. The final thing I will say is just to give us time. Sometimes you may hear about a case before we hear about a case. Students sometimes post on social media, let a faculty member know before they've let us know. So the important reminder is to tell the students, be sure to notify COVID test trace at columbia.edu so that they can initiate this contact tracing program, and really ask that any other messaging, communication, or decision-making is held off until the contact tracing process has taken place. I know that waiting can be an anxious period, but again, to give guidance before we've had the opportunity to conduct a case intake interview and really determine if there are any exposures could actually cause a lot more anxiety in the long run. So reassurance that so long as we get the information, contact tracing will take place and guidance will be provided. So thank you for that. I'm going to stop sharing and turn it back to Donna.
Thank you, Melanie. And we thought it would be really important for everybody to hear from a dean who leads a very large school. So I'm going to turn it to Dean Lisa Rosen-Metsch from the School of General Studies.
Thank you, Donna. And I just want to echo what Julie and Melanie has shared of the excitement having now thousands of undergraduate students from our 3 Columbia schools and then Barnard across the street on campus. And students, we have the first year students, and then we also have invited back the second year students who never experienced being on campus here. So students, I have to say, I've been to many, many events. The picture that we're showing right now, this was taken about 3 o'clock today. This was a session in Havemeyer Hall in 309. My colleague, Victoria Rossner, was giving a session on engaging the faculty. And I just wanted to share with you, I just stood up and took the picture that our students, very serious, very engaged, but all wearing masks. And we've had through the orientation programs, we have the orientation leaders, which are the other undergraduate students, and they've been like sentinels really watching. And if anybody slips in any area of compliance, they are right in there. And of course, all the students went through all the steps in uploading their vaccination and signing the compliance and going through the training. And anecdotally, we had a session today on academic integrity, and I saw the head of student conduct, and I think so far it's so good in terms of students. I think people really know their responsibilities and are really ready to get started. And just in the picture that I can show, as I think we've said before on this session, faculty can take their mask off when they are lecturing. And just to show you Professor Rossner here, she is, quite distant from the students. You can't see, but there's probably more about 10 feet behind there. And then, and this is in the classroom. I also had the opportunity to do a faculty lecture last week to students. This was in Schermerhorn and in 501 Schermerhorn. And I also was able to take off my mask, have appropriate distance to lecture. Students were all masked up. I will say one of the questions that comes up, can you hear the students? Are you able to communicate? And I would say most of the time I was clearly able to hear the students. And if there was a case when I wasn't, I asked the student to repeat their question. We also, in the session that I did, as well as the session you see here, we did also, we were live streaming it. So we did have some students on Zoom, and that was able to, I was able to know the questions and the answers. So in the case that faculty do decide if there are situations where they want to do, more hybrid, I think, those will be available in a lot of the classrooms. And I think really so far so good. I mean, I think we are all a community and we will be monitoring this and watching this very closely. And as I get questions from students, you know, at the end of September, are we going to be able to take our masks off and those types of things? And my answer is that we are in this all as a community. We have a monitoring system that's been put into place, and we are very fortunate to have the world-renowned experts here at Columbia University who are guiding us through this. And I guess the last thing I just want to say as a dean, I am extremely grateful to Wafaa, to Melanie, to Donna, to Julie, to Gerry, David, all the people on this call, because I think we have been so fortunate that we have the best of the best who are guiding us through this process in always prioritizing our health and our safety. That's it. Thanks.
Great. Thanks, Lisa. And Lisa makes a really important point, which is it's all of our responsibility to enforce face covering, in particular, across the campus. So we do have time for some of the questions that were asked. And I think the first couple really related to what you heard from Julie and Melanie about, you know, what happens when a student tests positive. One question, Melanie, you know, where do the guidelines come from? Did we make them up, or were they based on the CDC? What's the science behind, you know, vaccinated individuals who are asymptomatic not having to quarantine, for example?
Thank you. We didn't make them up, Donna. These are absolutely based on published guidelines from CDC and New York State and New York City. So we always have followed the guidance by those three agencies, the Departments of Health in New York State and New York City. We don't make it up, we don't adapt it, and all of those are based on data regarding incubation periods, length of viral shedding, risk for vaccine versus non-vaccine. So we've really stuck very closely with those. We review our contact tracing protocols with city and state to make sure we remain consistent with what the published guidance is, and we have continued to do so.
Great, thank you. Julie, there are a couple questions that I want to toss to you. One is about recording lectures. Should all faculty be recording their lectures to facilitate what might happen when students have to take time off from attending class?
Yeah, and I guess the answer to that is really, you know, it's up to the faculty member. Many faculty and many schools have in place recordings. They don't always make them available for students. They do it so that students have a resource to go back to when they're studying. But in this case, they may want to make those recordings available if students have to miss class because they're in isolation. But it's not required for all faculty. Not all classrooms have the capacity to do so. Not all faculty feel that their particular course lends itself. If you have a small seminar and there's a lot of back and forth and engagement among the faculty and the students, it's very difficult to capture that and record it because you don't have recording in every corner of the classroom and things get lost and it's not done well. So it's really up to the faculty member as to how they feel they can best represent their academic material to someone who misses a class. And I think, you know, this is not new. In pre-pandemic times, we had students who fell ill and had to make up classes and assignments, and they communicated with their faculty member, and those things took place. So we'll rely on those tested and tried mechanisms that we've always had in place.
Great, thank you. Another question for you, Julie, is how will students shop for classes?
So at the undergraduate, I think this is particularly relevant at the college. So I think, you know, these things, because we are back to returning in person, we expect that students will check the syllabus and make sure that they think a particular course is of interest to them, but they can attend the class just as they normally have done in years past. So the shopping period will go on as it has in previous years.
Great, thank you. I'm going to turn to David Greenberg. We have a few questions around our facilities. And one is a question about the practice of some, I won't just say students, but individuals, however they're part of the campus or even perhaps not part of the campus, and the tendency for doors to be propped open or individuals holding the doors for others. And how and when are we going to be addressing that access issue?
So, well, first I would say to the extent that you cannot prop doors open, you should not prop doors open. And we will have people, security going around campus. And if doors are propped open, we'll close them. All of our doors are on lock. There's, just on maybe one or two situations we've been requested to have them unlocked, but then we have interior portal security checking that people are in compliance as they come through, and we're going to continue to evaluate the situation and staff it appropriately.
Also, I would just add too that while the doors may be propped open, there are other mechanisms. Obviously, you hopefully have all heard of the Green Pass, Red Pass system. If you haven't been on campus, you may not be aware of this, but we will, beginning next week, start turning our Reopen CU app, which you are required to fill out every single day to describe your symptoms that you might be having or exposure to someone who has COVID, but it's also linked to your completion of the vaccine requirements, the gateway tests, the training, and the compact. So every day you should have something that looks like this that I'm showing in my screen, which is a green pass. Now, if you don't have a green pass, the opposite of a green pass is a red pass. And a red pass will mean that you cannot access buildings where there is swipe access. But in addition, we have lists of people. So let's pretend that you have your best friend and your best friend goes everywhere you go. You have a red pass, but that person has a green pass. We will find you. We will find you, and we will not allow you to access the campus, and we will take other disciplinary action, whether you're faculty, staff, or students. So we do know who is in compliance. That's how you actually get a green pass, not just because you fill out the symptom attestation, but because you've met all those other circumstances. So we will find you. It might take us a few days as we get into the September compliance period, but we will be able to remove people from the campus and take away other privileges that they have. So David, you also have a question about air quality and ventilation data on a classroom basis. Maybe a general description of what we have done, and then what information faculty, staff, and students can find out about particular buildings.
Sure. So what we have done, we did it at last year, and then we've reevaluated and continued this year, is a complete overhaul and check of all of our heating, ventilation, air conditioning systems, upgrade of filtration to a higher standard of filtration that is in line with CDC recommendations. And in addition, we have twice now, once before the beginning of last academic year, and then of course just this summer, have tested the airflow and air exchanges in over 400, close to 500 spaces around campus, all classrooms and some larger public spaces, to ensure that there's proper air exchange in those spaces. And almost all of them, with the exception of a handful, 20 or so spaces, have met or exceeded the air exchange standards. And for those that did not, we have addressed those spaces with supplementary filtration that's in line with CDC recommendations as well, with HEPA filters installed in certain rooms. All the large classrooms are certainly, they meet the specifications of the one that Lisa, I know, had a picture of in Havemeyer, was exceeded our threshold, Skirmerhorn 5th floor, Pupin 3rd. So we continue to monitor that as well. You can see on the website just our standard approach to our building checklist, which goes through all of the areas that we approached building readiness, not specific down to the level of air exchanges. But if you have any concerns about airflow, air exchange in a particular space, be in touch with the facilities liaison, who will be in touch with us, and we will, of course, investigate it and remediate as necessary.
Great, thank you, David. Wafaa, I'm going to turn to you. We have some questions about face coverings or masks. We are providing any student, any faculty member, any staff member, researcher who wants masks. We are providing 2 of the face coverings to you. The question that we have, it's a 2-part question. Can a faculty member request that students wear a particular kind of mask? And then what's your opinion about N95s, and should we be moving to N95 masking in classrooms?
Yeah, thank you. No, I think a faculty member cannot ask their students, the students in a class to use a particular mask. I think we have selected and support the types of masks that have been supported by guidance. As Melanie mentioned, we anchor our guidance in evidence, and the evidence indicates that that the option of the 2-ply cloth mask is quite sufficient, as well as all the other options that Melanie mentioned as well. So the students have the options to use those masks as indicated on our website. I think in terms of N95, we are not requiring N95, and N95s are really thought to be useful and should be utilized by individuals in healthcare setting, patient-facing kind of settings, and especially when they are involved in doing procedures and so on. So I think we want to adhere with the guidance that exists now, and we ask that the faculty keep that in mind and do not ask the students to go beyond that.
Yeah. I would just add, having been part of the PPE challenges that we had, that on some level it is imprudent to be requiring or asking people to use N95 masks, because we had a severe shortage of them that you may remember. And so we've restricted them on the Columbia Medical Center campus to those people who are performing aerosolizing procedures. And so the evidence on other masks is sufficient to protect us. Wafaa, one more for you, which relates to outdoor masks. And the question is, why are we not requiring masks in outdoor settings?
I think this is again based in evidence, and the evidence shows that transmission in outdoor settings is minimal. And that's the message, is that focus on where the risk is. And we believe that that outdoors, the transmission should be minimal. And that's the reason why we are going with indoor masking, because that's where the risk is. So this is, of course, anchored again in evidence. There may be situations, as you mentioned, Donna, like where, because there are non-affiliates in the mix, people, we don't know their vaccination status. And in those conditions, we might request that people do mask even if outdoors.
Great, thank you. I'm going to wrap up with one question from Melanie, which relates to students who do have symptoms and who are tested off campus. How will those individuals be able to find a doctor to help them to treat their symptoms?
They can certainly access, the students who pay their health fees can access our clinicians, even if their test was not done through us. Both campuses have telehealth appointments available, so students should reach out to their campus health service to get guidance on clinical monitoring. And as I say, we do continue to monitor them during their isolation period. If it's a student who has not paid a health fee, we can certainly, and contact tracing can help provide guidance in terms of an off-campus provider. But most of this is done, as I say, through case management and through contact tracing.
Great, thank you. We are out of time. Thanks to all the panelists, and thanks to you for listening and for submitting your questions. As I said, we will be back in 2 weeks and be able to provide you with a substantial number of updates on how things are going on the campus. So thank you, everybody.
Thank you. Bye-bye.